Hi, my name is Paige. I am a senior studying health sciences. I have chosen to research inventory control in healthcare facilities. Inventory is a stock or store of goods. Inventory control involves organization and supervision of the supply, distribution, storage, and recording of materials in order to maintain suitable quantities. By controlling inventory, companies can maximize the use of inventory within their facility. The main concerns that inventory control focuses on is the level of service and the cost of ordering and carrying the supplies. Hospital inventory costs vary from 25 to 32% of the total revenues, so it is extremely important for managers to be aware of their inventory supplies and the total spendings invested. Examples of medical equipment consist of wheelchairs, ventilators, hospital beds, stretchers, defibrillators, x-ray machines, ultrasound equipment, thermometers, scopes, pulse oximeter, patient monitor, and crutches. Some general materials include gauze, needles, scissors, gloves, band-aids, tape measure, patient record sheets, and trolleys. One of the biggest parts of medical inventory is the actual medication and pharmaceutical supplies distributed to patients. Inventory control is so important in maintaining an appropriate amount of supplies to avoid understocking and overstocking. Undersupply of inventory makes it extremely difficult to facilitate the maximum potential quality of care, and physicians risk losing sales. Physicians may have to refer their patients to another facility because of desired supplies such as brand names or specific supplies that are unavailable at the current hospital. Therefore, they are losing the sales from that patient. Although these are both very crucial to the business, the most dangerous risk that healthcare facilities face is a chance of patient death. When supplies are scarce, a doctor may be unable to care for their patient's survival needs. On the other hand, a surplus of inventory is not ideal either. When there is too much of an item, the facility may lose money due to interest, insurance, taxes, depreciation, deterioration, spoilage, and breakage. Another important fact to look at when looking at inventory control is that every hospital in the nation must cut $2.6 million a year in costs in the next 10 years to meet President Obama's health reform. Managerial duties with inventory control consist of setting inventory policies, estimating the required amount of each supply, determining the frequency of order and delivery, maintaining inventories at the lowest cost, balance overstocking and understocking, selecting suppliers, which may be local or international, and they may be wholesalers and retailers, manufacturers, central medical stores, or nonprofit supply organizations. They must also place the order, in which they use an order form and follow specific guidelines. From here, they receive the order, and they should have 2 people check the supplies in order to make sure there are no damages and they received exactly what they had ordered. They then are also in charge of distributing the supplies, where they should record the date of distribution, items and quantities, and the name of individual receiving. It is very important for them to then obtain a signature from the individual that receives the supplies to eliminate any problems in the future. Even after distribution, they have some responsibilities consisting of keeping track of the location and storage of inventory and recording all inventory issued to each department. The most effective way to control inventory is by carefully and precisely estimating the appropriate amount of supplies that are needed prior to each order. Predicting the necessary amount of inventory that is needed lowers the risk of undersupplying and oversupplying. There are a few things to consider when estimating the supply needs. First, how much is normally used. Also, seasonal demands, how often the item gets ordered, and the amount of storage space. A good way to estimate supply is by using quantification methods. Quantification methods are used to calculate and estimate the amount of medical supplies, medication, and equipment required for a given department or facility. Quantification methods are also useful in estimating the total costs. 2 examples of quantification methods are the consumption method and the Morbidity data method. Consumption method uses data related to past consumption in order to calculate what quantities will be needed in the future. Morbidity data method uses data related to prevalence and incidence of disease and health problems and the standard treatments for those in order to estimate future requirements. The consumption method is the preferred method for estimating requirements. Here are a few important terms when it comes to estimating supply amount. Lead time. The lead time is how long it takes between ordering and receiving supplies. This can also be referred to as the delivery time. Reserve stock is the lowest level of stock for each item. Quantity should never fall below this line. Reserve stock is essentially the extra supplies that a company may have to avoid stockouts. Minimum stock level is the level that indicates a new order is needed. The maximum stock level is the maximum amount of any item you should have at any given time. Here is an example of calculating quantity. You can see here the annual requirement of syringes is 480. The time between orders is 6 months, the balance is 120 syringes, and the lead time is 2 months. Below we have the formula and the calculations to figure out how much supply this company needs. AMC stands for average monthly consumption. You can calculate the AMC by taking the total quantities issued in the time period divided by the number of months in the time period. For this particular company, they have taken 480 divided by 12 in order to get 40 syringes for their average monthly consumption. The reserve stock is 1 month when the lead time is 2 months. By multiplying 1 times 40, the average monthly consumption, you can calculate the reserve stock to also be 40. The minimum stock level is the reserve level plus stock used during the lead time. Here they took 40 and added to 2 times 40 in order to get 120 syringes. Order quantity is equal to the time between orders times the average monthly consumption. By taking 6 multiplied by 40, you can get 240 syringes for the order quantity. The maximum stock level is calculated by taking the reserve level and adding it to the order quantity. Here they have taken 40 plus 20 in order to get 280 as their maximum stock level. Another important aspect in inventory control are supply chains. A supply chain is a sequence of events in getting a good or service from a supplier to a customer. 3 main parts of healthcare supply chains include producers, purchasers, and healthcare providers. Purchasers are a group of purchasing organizations, or GPOs, and wholesalers or distributors. Communication through the entire supply chain is pivotal in controlling inventory costs. Here is a chart of a healthcare supply chain. You can see they first start with the manufacturers, which can be pharmaceuticals, medical or surgical supplies, and devices. Next are the purchasers, which can be distributors, which are wholesalers or e-distributors, and GPOs, the group purchasing organizations. Next are the providers, which consist of hospitals, physicians, integrated delivery networks or IDNs, and pharmacies and other hospital systems. Lastly are the end users or payers, which consist of patients/individuals, employers, insurers, HMOs, drug benefit agencies, and governments. With inventory control comes many different challenges. The first being high spending with little accountability and control. Most systems used to check inventory and place orders are outdated. Also, few facilities use automated systems. Automated systems can relieve a company from making human errors. Also, there tends to be a lack of inventory visibility. It is extremely hard to easily track product usage. When patient flow increases, the supplies decrease, and so it is common for a healthcare provider to get extra supplies from the storeroom on their own time. This results in hidden processes which do not allow material managers to know the exact product usage. Another challenge is manual processes. Inventory management staff count supplies on their own, which leaves room for human error. Storage rooms within a facility create challenges. Oftentimes, supplies go untouched and unused by the time it is expired or otherwise become worthless. This is a huge problem because nearly $10.2 million of supplies are in stock rooms. So when supplies are going unused, a company is losing a lot of valuable money. Here are ways to improve care and reduce cost, which is making the most of inventory. Make supply chains more demand-driven. Increase visibility of practices and inventories. Implement more standards and better standards. Create central purchasing. Reduce inventory. Improve demand forecasts. Reduce labor costs through automation. And improve collaboration with vendors. Here's one successful way in controlling inventory costs. An innovative step is stockless inventory. Stockless inventory focuses on shifting inventory management functions up the distribution supply chain. Stockless inventory eliminates inventory in the storeroom, which we saw to be a potential hazardous aspect to healthcare facilities. Just-in-time delivery systems are one example of a stockless inventory. Just-in-time delivery systems have the ability to get supplies when a facility needs it all throughout the week. Rather than placing bulk orders every so often throughout months, years, a healthcare facility can request supplies that they need when they need it throughout the entire week. Stockless inventory have automated order entry systems. This eliminates human error. A company can just automatically input the supplies that they need, and it will keep track of what they need and when they need it, and will not need for a human manager to request an order each time. Benefits of stockless inventory can consist of reducing costs of inventory below level afforded by just-in-time inventory. It eliminates costs of upkeeping a storeroom, and it reduces costs of obsolete supplies. Here's one success story of stockless inventory. The University of Michigan Hospital had a total revenue valued at $1.4 million. Even with this amount of inventory, they were very consistent with stockouts. They had oversupply sometimes, and there was loss of items throughout the facility. Over a 6-year span, the University of Michigan Hospital cut their inventory costs from $1.4 million to $400,000 due to the implication of stockless inventory. Inventory turnover rate increased by more than 600% from 4.5 to 32 times a year because of the stockless inventory that the University of Michigan Hospital implemented. Inventory control is very important in the healthcare facility because healthcare is very expensive, and patients need the supplies in order to get the maximum potential care that they are in the facility for. Inventory control is a very important topic that many of us should take into consideration when dealing with healthcare management in our future. Thank you for watching my presentation on inventory control.